Good evening. Thank you very much. And thank you for all my colleagues and senior colleagues who are in this forum to listen to me. And I thought I'll be talking on music and disability because we know that there are a lot of ways of preventing disability. There are many disorders lead to disability. There are various therapeutic approaches to disability. And music as one of the main therapeutic approach to the disability management. It will be very interesting that I'll be sharing some of the concepts of music and disability in this presentation. Davis in 2002 defined an impairment involves a loss or diminution of sight, hearing, mobility, mental ability, and so on. But impairment only becomes a disability when the ambient society creates environment with barriers. So what is disability is based on that how the society reacts to the disability of the particular person. That's very, very important. Strauss in 2006 defined disability as any culturally stigmatized bodily difference. So once, suppose I have some difficulty in reading, understanding, writing, or performing, that I can still live with all those things. But the society, culturally, sometimes they stigmatize the bodily difference. Then it became a disability. If you take the autism, because it's one of the common disability disorder, which they see the pediatrician, neurologist, and many general practitioners, family physicians. It's a spectrum disorder. I'm not going to talk about learning disability, which is going to be delivered, the lecture delivered by Dr. Arulmoli. I'm going to talk only on music and disability. It's a spectrum disorder that includes a broad range of manifestations. Sirota in 2010 span a wide continuum, and many demonstrate functional capacities from limited to extraordinarily limited. Some people have limited disability, some people have more disability. Autistic brains are different from non-autistic brains, not better or worse, just different. That we have to keep in mind, because many of these people can have some different beautiful skills which normal people may not possess, which the society may not check it, and our education system may not check that kind of capacity. So we have to keep in mind autistic brains are different from non-autistic brains, not better or worse, just different. There is an entity called Autism, and there is an organization called Autism Ensemble. It's a neurodiverse group that features children on autism spectrum disorder performing original music together with their parents and professional musician, and it is committed to such goals actually. So this is basically an organization where they involve the children and the parents, the family, and the professional musician, and they work as a group actually. Autism responding together in sound and movement. So we have to keep in mind these people respond in a different way to different stimulus. So the autism responding together in a sound and movement environment, that is autism. American Music Theory Association, the music therapy as a treatment modality in autism spectrum disorder. There is a separate organization called American Music Therapy Association, and music therapy is used as a treatment modality in autism spectrum disorders. Music therapy provides a unique variety of music experiences in an intentional and developmentally appropriate manner to effect changes in behavior and facilitate developmental skills. So there are many times the children or even adults, grown-up adults, and we group their behavior in a different way, and we say they are not up to the mark or they don't have skills like that. So that there are some interventional measures like music therapy. It changes the behavior and facilitate the developmental skills. Music therapy can stimulate individuals with autism spectrum disorders to reduce negative and self-stimulatory responses and increase participation in more appropriate and socially acceptable ways. Music is processed in both hemispheres of the brain. This is a very important concept. The music is processed in both cerebral hemispheres. It can stimulate cognitive functioning and may be used for remediation of some speech and language skills in persons with autism spectrum disorder. So we have to keep in mind music can stimulate both brain because it is processed in both hemispheres of the brain. Strive to decrease the loudness of the performance in accordance with aforementioned sensory challenges of many autistic people. So we have to keep in mind that sometimes some people don't like loud noise. Some people don't like loud music. Some people like soft music and soft speeches. So there are people in the society itself, they have this kind of different spectrum of people. And many of these autism spectrum disorder children, they don't like very loud noises. Instead, we have to instruct the audiences to show their appreciation, not by clapping, which is disturbing to many sound-sensitive autistics. By employing the customary forms of silent applause used at autistic community gatherings. Self-stimulatory behavior or stimming is a classic symptom of autistic stereotypy. The common stimming include hand flapping, covering of the ears, spinning and twirling, rocking back and forth or from side to side. This is a common the stimulatory, self-stimulatory behavior. It's called as stimming. Some dysfunctional system in the brain or periphery. What is the reason for all these things? Is some dysfunctional system in the brain or periphery. The music therapy helping these people. Christopher Small definition of musicking. This is one of the way of spelling that musicking. Music is to take part in any capacity in a musical performance, whether by performing, by listening, by rehearsing or practicing, by providing material for performance or by dancing. Musicking can take place anywhere and can be done by anyone. So we have to keep in mind, musicking is not only performer, the people who take part and who listen to it, we've also sing in a small way, and they have different knowledge about music. Everything is as a part of the music. So we don't need to be a singer or performer and to get benefit from the music therapy or from the music. Small argues the fundamental nature and meaning of music lie not in objects, not in music works at all, but in action, in what people do. It is only by understanding what people do as they take part in a musical act that we can hope to understand its nature and the function it fulfills in human life. Use of music therapy for people with learning disabilities has many benefits. It can help to improve communication, interaction, and self-expression. Music therapy helps to empower people by offering them choices, increase motivation, and encourage physical activity and coordination. Can also be used to learn new things at young age. Suppose even people with normal intelligence, normal intellectual ability, it enhances their learning power, learning the new skill by listening to music. With the help of music and song, children can learn letters, numbers, and more. Learning challenges can affect a child emotionally, behaviorally, and physically. It gives emotional benefit, behavioral benefit, physical benefit. Introducing music into the day-to-day activities can help improve their well-being. Playing an instrument can help children with ADHD or learning disabilities by increasing their attention span and their appetite for learning. Music has powerful effect on everyone. Can be used in educational setting for children or adults with complex needs. The benefits of using music with special needs education are: music helps bonding, it has a multi-sensory experience, it improves motivation, it improves self-regulation. Music helps you bond. Listening to, singing, playing, dancing to music can create a strong bond between the parent and the child or student and teacher. Introducing physical instruments into this routine can improve child's attention and motivation to learn. So along with singing, listening, playing, child learns an instrument, it gives much more benefit. Multi-sensory experience. Example, child playing with a drum, they feel the drumstick in their hand, engage movement of their arm and wrist to bang the drum, and hear the noise it makes on the impact. Their visual senses are also triggered as they focus on a point of the drum to hit with the drumstick. Motivation. It can be used as a motivation tool. Sportsmen and sportswomen use music in a bid to motivate themselves before competing. You would have seen in all the international game programs or sports or organization programs. They form a theme song and they put a music before the sportsman or sportswoman start playing. It motivates them. The same therapy can be used for children and adults with the complex needs. Music therapy can be used to motivate a child to work on difficult tasks. Singing a song during a challenging task, a child may be more willing to go along with it. Use different instruments to develop motor skills. Use an instrument to promote communication. Non-verbal benefits. Music can be non-verbal, especially good for children or adults who are non-verbal themselves. Playing music with beats, with the tunes, can bring a child out of moody atmosphere. Music can give physical stimulation and can be used as a motivational tool to begin the task. Music as a therapy improves behavior and emotions. It's a useful treatment for neurological ailments like brain injury, seizure disorder, Alzheimer's disease, and tension headache. It stimulates learning ability. Repetition aids in improving memory, and rhythm of music helps in the ability to recall. Improves a person's attention and make it more effective. It reduces anxiety and relaxes an individual when stressed or excited. It's very useful for stress-related disorders. Gives energy and motivates the individual to continue the act with additional effort. Improves both verbal and non-verbal communication. Improves the physical skills of an individual. Helps in pain management and makes a discomfort better. People have done a study in pain management along with regular therapeutic interventions. They done a music therapy. The pain perception become better. Socially equalizes the people. Music socially equalizes the people. Create an atmosphere for people with disability to interact with those who do not have the same difficulties. Music helps people to express and experience different types of emotions and control emotional outbursts. Gives a general sense of satisfaction and strengthens self-esteem. As per different culture, music can be personalized and inclusive. We have to keep in mind that there are different culture and people tendency to listen to a particular music is different, their language is different, and some people, like as I told, that people with autism spectrum disorder, soft music compared to very loud music. So it has to be personalized and it has to be tailored to the particular person need. In a group setting, music can make the feeling of disability to fade or disappear. So if you do the music therapy as a group of people, suppose you call all these people with a disability one day and give a music therapy and speak to them, counsel them, it gives a large benefit to this group of population. Music helps. Sorry, I think. Benefits of music therapy in learning disabilities: communication, social skills become better, sensory difficulties become better, behavior become better, cognition become better, perceptual motor abilities become better, self-reliance or self-determination become better. Encourage the person to listen, encourage spontaneous expression, stir a desire to communicate, strengthen muscles and improve coordination, help to build relations. It improves the concentration, provides a means of self-expression, stimulate language development through songs and turn-taking, excite imagination and creativity. There are many papers, like thousands of papers that I just want to put down some papers which are relevant to neurological practice. Why and how music can be used to rehabilitate and develop speech and language skills in hearing impaired children. There's a beautiful study done by Tarpa R. Et al. That is published hearing in 2019. Very important paper, how it improves the speech and language skills. Music therapy for stress reduction. There is a systematic review and meta-analytic study done by D. White M. et al. It is published in Health Psychiatric Review in 2022. Music education for improving reading skills in children and adolescents with dyslexia. There is a Cochrane database available in 2012. Effect of active music therapy and individualized listening to music on dementia. Multi-center randomized control trial done by Raglia et al. Published in Journal of American Geriatric Society in 2015. The impact of invisible illness and invisible disability on music therapy practice of students. There are many invisible illness and invisible disability. Many times we also we don't know how to express our physical ailment. There are some ailment which doesn't belong to any specific category. And the people who go for this music therapy or learning music, they become better. and it is published by Warren R.J. et al. In Journal of Music Therapy in 2020. Effects of music therapy intervention on enhancing social skills on children with autism is a beautiful paper presented by Law Gesti AB et al. In Journal of Music Therapy in 2014. Mozart's music and multi-drug resistant epilepsy. There are many papers on Mozart's music and epilepsy. I think if you go through the PubMed, you can get many papers on that, especially drug resistant epilepsy and very interesting papers. Potential EEG index of therapeutic effectiveness done by Bendetti C et al. They found that EEG changes as well as therapy. There is a benefit of listening to this music. It's published in 2018. Music-based therapy in rehabilitation of people with multiple sclerosis. Systematic review of clinical trials done by Josiane Lopes et al. Published in 2021. They have taken multi-modalities like listening, hearing, and sensory symptoms, and so they've taken all the kind of multi-sensory perception symptom of this multiple sclerosis patient. So along with the rehabilitation and therapeutic intervention, they found the music-based therapy has done a lot of benefit to this population. This is my last slide. It's a musical child, like a very interesting child they quoted in one of the literature. A 6-year-old girl was physical and developmental delay, is somewhat verbal and interacts in a limited way with others. When she began music therapy at age 3, it quickly became obvious that she had exceptional innate musical ability. The people doesn't know that they thought she don't know anything, and she has a dyslexia and disability. She could play the piano by ear, by listening to ear, although her hands have only 4 fingers. Even though she rarely spoke, she sang and in tune. She could play like a pianist by just listening to the ear, and she had only 8 fingers, and she can sing and she could sing and in a good tune, and even though she rarely spoke. It's very important to know that there are some musical people, they're born musically, and as I told initially, their autistic brains are different brain. They are not better or bad or like that. So it's very, very important. Our society has a specific mode of educational pattern. That's why they become discriminated. It's very, very important that we have to involve the role of music in rehabilitating these children or even adults and other neurological disorders to understand the concept of and the benefit of music therapy to this neurological population or any other person in the society who needs it. Thank you very much for listening to me. Thank you.